Well, we suspected it might happen because of the increasingly uncontrolled spread of the Delta variant and the resurgence in COVID-19 cases. And it is happening. The CDC coming out with new mask guidelines yesterday. We are going backwards. The masks are going back on in many, many places. And seemingly overnight, I'm already seeing more masks just walking around. And yes, this is even for vaccinated people. We're going to look at the new guidelines, and I am going to sort of couch it all in saying the situation has not really changed that dramatically for vaccinated people, although it has changed, and it's important to understand the ways in which it has. But this is continuing to increasingly be a virus that is being spread by unvaccinated people, which is disproportionately seriously affecting unvaccinated people. And that, for now, appears to be the way it is going to continue. But that doesn't mean, given what's going on, that vaccinated people shouldn't take precautions in certain places. So let's look at the new CDC guidelines updated yesterday. When you've been fully vaccinated, okay, if you are fully vaccinated, you can participate in many of the activities that you did before the pandemic. To maximize protection from the Delta variant and prevent possibly spreading it to others, wear a mask indoors in public if you are in an area of substantial or high transmission. That is a major change. Whereas before, the position was if you're vaccinated, you don't really need to wear a mask anywhere. The new guidelines are if you're vaccinated, but you're indoors in public, meaning not with 5 other people whose vaccination status but if you're in public indoors and in an area of high transmission, which you can look at a county by county level, substantial or high transmission, the new recommendation is to wear a mask. For me, what does that mean? Well, that means when I go to the grocery store, the mask is going back on. It goes on to say the new guidelines, wearing a mask is most important if you have a weakened immune system or if because of your age or an underlying medical condition, you are at increased risk for severe disease, or if someone in your household has a weakened immune system, is at increased risk for severe disease, or is unvaccinated. If this applies to you or your household, you might choose to wear a mask regardless of the level of transmission in your area. You should continue to wear a mask where required by laws, rules, regulations, or local guidance. So this is a significant change, and we are seeing the spike. I mean, if you look at the U.S. case numbers, you will see that starting, right around June 22nd, about a month ago, after getting down below 10,000 cases per day, cases started to go up, including even some 65,000 case days. Now up to an average of about 57,000 cases per day. Now, what's the hope here? The hope is that much like we are starting to see in some other countries, for example, if you look at the UK, which was essentially one of the hubs of the Delta variant, we have already apparently hit the peak of cases in the UK. The peak in the UK of Delta seems to have happened around July 22nd. And they are now down from about 46,000 cases a day to about 32,000. That's a significant reduction. The hope is that what is now a sort of leveling out, as you can see over the last few days, the cases aren't continuing to increase in the U.S. They're sort of flattening out. The hope would be we are now going to be on the decline, but we don't know if we are. And part of that depends, of course, on taking precautions. So let's not go crazy one way or the other. I think there's a lot of hyperbole on both sides here, and I'm not playing a both sides game. The people responsible for this are overwhelmingly the unvaccinated people and the people taking no precautions. But the reactions have been sort of extreme on both sides. There's one side that 2 months ago said the pandemic is over. Many of these people were never wearing masks. Many of these people are still not vaccinated, and they're going back and to quote Dr. Anthony Fauci, letting it rip. That's an extreme reaction on one side because it's clearly not over. On the other side are the people who are seeing this and now saying we are back to the pre-vaccine uncontrolled spread era. The truth is that for the Delta variant, if you're vaccinated, you're very well protected. And that protection is bolstered by people around you being vaccinated. Now, just like with the flu, there are people who are vaccinated who are otherwise mostly healthy, who will get what's called a breakthrough case, and they will end up hospitalized, and a few of them are going to die. And that's a terrible and tragic thing. But it's important to remember that that also happens with the flu. And that doesn't mean we ignore this fact, but it also doesn't mean that we all of a sudden believe there's no protection and we're going back to the pre-vaccine COVID era. The truth is that for the most part, you are quite well protected if you are vaccinated. You are really unlikely to get very sick. You are really unlikely to die. However, you could spread it. You could spread it to someone who is in a more compromised position. And although that's the situation with the Delta variant, the more people remain unvaccinated and the more the spread continues, the next variant could be more deadly. The next variant could be even more transmissible. And as we've said before, imagine if this had an 8% mortality rate or a 10% mortality rate. I don't know that people are looking to read about this type of stuff right now. I don't know, people are looking for this type of fiction, but I recently read Lawrence Wright's pandemic novel. I believe it's called The End of October, where it's a very similar situation to the one we have, except it's like a 10% death rate instead of a 0.8% death rate or whatever we believe the real infection fatality rate to be. That is a dramatically different situation. The more we don't get vaccinated and the more this continues to spread, it increases the chances of such a variant developing in the future. So these are the rules at this point in time. People asking me if I'm canceling my upcoming travel. I'm not. And the reason I'm not is this situation of different pops and spreads, particularly among the unvaccinated, is likely to continue for a couple of years. And so if I'm not willing to travel now, I probably shouldn't travel for years. And I've made the decision in speaking with friends who are doctors and others that right now, based on when I got vaccinated and based on this particular variant, and based on the fact that I'll be wearing a mask everywhere that it's recommended, I don't see a particular reason to cancel that trip now. But a lot of the questions are, where are you going and what is your health status, et cetera. One example, we're talking on the bonus show today, Nevada is going fully mask back on, and people are being advised to avoid Las Vegas. The level of uncontrolled spread in Las Vegas is so high. The case positivity rate is so high that's a point where people are being told, just don't go there. And I don't plan to. So that's the situation there. One of our sponsors is SteadyMD Primary Care, the easier and more affordable way to do primary care. And they're giving you 50% off because you are in my audience. You just answer a few questions. SteadyMD will match you with a licensed primary care physician that's tailored to your needs. You'll have a 1-hour virtual appointment and start a meaningful relationship with your new doctor. And from then on, your doctor will be available to you by text, phone, and video chat. It's not some random doctor on call. Your SteadyMD doctor has a limited number of patients. You get the attention you deserve, and they can help you with anything your primary care doc normally would. It's very cool how it works. You don't need insurance. It's just $99 a month, no other fees or copays for visits. Take the free quiz and see which doctor is a perfect fit for you. You'll get 50% off your first month when you go to steadymd.com/Pacman. No risk, no long-term commitment. The link is right underneath the video.